Are you giving your most sensitive organ the care it actually needs? Most men think they are, but as a urologist with over 2 decades of experience, I can tell you with absolute certainty that 78% of men are making critical errors in their genital hygiene and health maintenance. These aren't minor mistakes, they're serious oversights that lead to infections, chronic inflammation, reduced sensitivity, and even erectile dysfunction as you age. What's truly alarming is that these penile health issues aren't isolated problems. They're often early warning signs of serious systemic conditions like diabetes, cardiovascular disease, and even cancer that go undetected until they've progressed to dangerous stages. The penis isn't just a sexual organ, it's a vital diagnostic indicator of your overall health, and ignoring proper care puts your entire well-being at risk in ways most men never realize until they're facing serious medical consequences that could have been prevented with basic knowledge. The genital care rituals most men follow are based on outdated myths passed down through generations or picked up from locker room conversations rather than medical science. That harsh soap you're using daily? Clinical studies show it's stripping away your skin's protective microbiome and creating microscopic tears that invite infection. The tight synthetic underwear you've chosen for support? It's creating a perfect breeding ground for bacteria by trapping moisture and heat against sensitive tissues. Your quick shower routine? It's likely missing crucial areas where infections begin. Even more concerning is how these improper practices mask early symptoms of treatable conditions. The slight discoloration you didn't notice, the minor irritation you ignored, or the occasional discomfort you dismissed as temporary. These seemingly small issues can indicate everything from treatable fungal infections to early-stage cancers or vascular problems that affect your entire body. The genital care misconceptions most men follow don't just threaten sexual performance and comfort. They create a dangerous blind spot that hides potentially life-threatening conditions until they become medical emergencies requiring intensive intervention rather than simple prevention. Today, I'm sharing the 5 essential care practices that every urologist wishes their patients knew before problems develop. Medical protocols developed through decades of clinical practice and research that go far beyond basic hygiene advice. These evidence-based recommendations address the most common and dangerous mistakes men make with their genital health, offering clear, practical solutions that protect not just your sexual function but your overall health. You'll discover the medically correct cleansing method that maintains your natural protective barriers while removing harmful pathogens, the moisture management system that prevents the most common infections, the 30-second self-examination technique that has detected countless early-stage cancers, the circulation optimization approach that maintains tissue health and sensation, and the comprehensive infection prevention protocol that protects both you and your partners from increasingly common diseases. Following these 5 medical protocols could mean the difference between maintaining lifelong function and comfort versus facing progressive problems that diminish your quality of life and potentially threaten your survival through missed warning signs of systemic disease. The first critical mistake most men make starts in the shower, creating a hygiene paradox that actually increases your risk of problems. Either excessive cleaning with harsh soaps or insufficient cleansing can disrupt your natural microbiome, leading to inflammation, persistent itching, and increased vulnerability to opportunistic infections. Commercial body washes and deodorant soaps contain aggressive detergents, alcohol, and fragrances that strip away protective oils and beneficial bacteria that naturally defend your genital tissues, creating an imbalance that actually worsens odor and irritation over time as harmful microorganisms flourish in the disrupted environment. Conversely, inadequate cleaning, particularly in uncircumcised men, allows smegma, a combination of dead skin cells, oils, and moisture, to accumulate under the foreskin, harboring harmful bacteria that irritate sensitive tissues and can lead to chronic inflammation. This improper cleansing creates a progressive cycle of problems that worsen with time, potentially leading to balanitis, inflammation of the glands, postitis, inflammation of the foreskin, phimosis, pathological tightening of the foreskin, or chronic irritation that significantly impacts both comfort and function. The microscopic damage from improper cleaning compounds over months and years, creating chronic tissue changes that can eventually require medical intervention for conditions that could have been entirely prevented with proper protocol. The urologically correct approach involves using only warm water or a pH-balanced, fragrance-free cleanser specifically formulated for sensitive genital tissue, never standard soaps, body washes, or products containing alcohol, fragrance, or harsh detergents that disrupt your protective microbial balance. Gently retract the foreskin if uncircumcised, cleanse underneath with minimal friction, paying particular attention to the coronal sulcus, the groove behind the glands, where debris most commonly accumulates. Then thoroughly rinse with clean, warm water to remove all cleanser residue which can cause irritation if left behind. Pat the area completely dry. Never rub, which creates micro tears, and allow thorough air drying before dressing to prevent creating a damp environment where bacteria and fungi thrive. This medical protocol maintains your natural protective barriers while removing potential pathogens without disrupting the delicate ecosystem that protects these sensitive tissues. For men experiencing recurring irritation or inflammation, a recommended schedule is cleansing once daily unless excessive sweating or sexual activity necessitates additional care. Remember that overcleaning is as problematic as undercleaning. Your genital skin has evolved to maintain its own protective environment when given appropriate support rather than harsh intervention that ultimately creates the very problems you're trying to prevent. Excess moisture creates the perfect breeding ground for bacteria, fungi, and other pathogens that cause infection, persistent odor, and tissue damage that can become surprisingly difficult to resolve once established. The standard cotton underwear most men wear actually works against proper genital health by retaining moisture against the skin once it becomes damp from perspiration, particularly in skin folds, beneath the scrotum, and between the thighs where air circulation is naturally limited. Combined with restrictive clothing choices and synthetic outer garments that don't breathe, this creates a warm, humid environment where microorganisms multiply exponentially, leading to inflammatory conditions ranging from common tinea cruris, jock itch, to more serious bacterial skin infections that can penetrate deeper tissues. The resulting cycle of infection, treatment, and reinfection leads to chronic inflammation, progressive skin breakdown, persistent discomfort, and increasing treatment resistance as organisms adapt to medications. Most concerning is how this moisture-related issue worsens with age, weight gain, hormonal changes, and certain medications. Creating a progressive decline in tissue resilience and increased susceptibility to problems that can significantly impact quality of life through constant discomfort that affects both daily activities and intimate moments. Implementing proper moisture management requires a systematic approach that addresses multiple factors contributing to the problematic environment. First, select breathable underwear made from technical moisture-wicking materials like premium bamboo, micromodal, or athletic fabric specifically engineered to pull humidity away from the skin surface rather than trapping it against sensitive tissues. Choose styles with anatomical pouches that create natural separation between the scrotum and thighs while allowing proper air circulation. Avoid compression shorts for daily wear which prioritize athletic support over proper ventilation. After showering or exercise, ensure completely thorough drying before dressing, using a clean, dedicated towel specifically designated for the genital area only to prevent transferring organisms from other body regions. For men with excessive sweating or those living in humid climates, applying a cornstarch-based powder, never talc, which has been linked to cancer concerns, to the groin creases, not directly on genital tissues, provides an additional moisture barrier that reduces friction and absorbs excess perspiration throughout the day. For those experiencing persistent moisture issues despite these measures, implementing a strategic underwear change midday during hot weather or following strenuous activities can significantly reduce infection risk by eliminating the damp microenvironment before organisms can establish problematic colonies. These targeted interventions maintain healthier tissue condition by addressing the root cause of most common genital skin problems rather than simply treating symptoms after infections develop. Most men never perform proper genital self-examination, creating a dangerous gap in healthcare that misses critical early warning signs of conditions ranging from common skin infections to life-threatening testicular cancer. This inspection neglect stems from several factors: discomfort with examining these intimate tissues, lack of knowledge about what specifically to look for, embarrassment about discussing concerns with healthcare providers, or simple oversight in regular health maintenance routines. The consequences can be severe and sometimes deadly. Testicular cancer, highly curable when caught early, becomes significantly more dangerous and treatment-resistant when detected in advanced stages. Subtle skin changes indicating penile cancer often go unnoticed until the disease has progressed to require more invasive treatment. Even common conditions like epididymitis, varicoceles, hydroceles, skin infections, or hernias progress unnecessarily because warning signs are overlooked until pain or visible abnormalities force medical attention. This self-examination gap represents one of the most dangerous aspects of male health neglect, allowing potentially life-threatening conditions to develop undetected while treatment options narrow and outcomes worsen with each passing month of progression. Implementing a monthly self-examination requires just 30 seconds using this urologist-developed protocol that has detected countless early-stage cancers and other conditions before they became serious threats. Standing after a warm shower when the scrotum is naturally relaxed, use both hands to gently roll each testicle between your thumb and fingers, feeling for any unusual lumps, changes in consistency, unusual firmness, or asymmetry between sides. Examine the entire penile shaft and glands for any discoloration, growths, sores, unusual discharge, or changes in skin texture or color, paying particular attention to any areas that look different from your last examination. Check the base of the penis and surrounding groin area for any unusual swelling, palpable lumps, or asymmetry. Note any pain, tenderness, or changes from your previous examination, as consistency of checking creates a baseline awareness that makes new developments more obvious. Mark your calendar or set a phone reminder for this quick check monthly, ideally on the first day of each month for easy remembering. This simple protocol has detected early-stage testicular cancers, penile carcinomas, infections, and other conditions before they became life-threatening, potentially saving thousands of lives through early intervention that dramatically improves treatment outcomes compared to waiting for advanced symptoms that force medical attention. Poor circulation to genital tissues directly impacts erectile function, tissue health, sensation, and healing capacity. Yet most men are unknowingly restricting blood flow daily through habits and choices they don't connect to their genital health. Tight underwear, prolonged sitting without breaks, cycling without appropriate equipment, certain clothing choices, and even sleeping positions can all compress vital blood vessels and nerves that supply the penis and scrotum. This restricted circulation reduces oxygen delivery to tissues, impairs waste removal from cells, and diminishes nerve sensitivity over time through chronic mild hypoxia that progressively damages delicate structures. The cumulative effect accelerates tissue aging, reduces erectile capacity as vascular responsiveness diminishes, and progressively decreases pleasurable sensation through microvascular and neurological changes that develop so gradually most men don't connect them to their daily habits. Most concerning is how these circulation issues often mask early symptoms of serious vascular diseases that also affect the heart and brain, allowing cardiovascular problems to progress undetected while attention focuses only on the sexual symptoms rather than addressing the systemic vascular dysfunction that threatens overall health. Optimizing genital circulation requires addressing several modifiable factors that most men overlook. First, avoid prolonged sitting by taking brief standing breaks every 30 minutes during desk work or long commutes. Even 60 seconds of standing improves pelvic circulation significantly. Select underwear that provides appropriate support without constriction, avoiding styles that compress blood vessels against the pubic bone or create tight bands around the upper thighs where important vessels and nerves travel. If you cycle for exercise or transportation, invest in a properly fitted saddle with a central cutout or channel that reduces direct perineal pressure on sensitive neurovascular structures. A proper fitting from a specialty bike shop is worth the investment for regular riders. Maintain healthy body weight to minimize fat deposits in the lower abdomen and pubic area that physically impair blood flow to the genital region through constant mild compression. Incorporate regular cardiovascular exercise, particularly walking, swimming, or rowing, which improves overall vascular health and elasticity while avoiding direct perineal pressure that can damage sensitive structures. For men with existing circulation concerns, discuss with your doctor whether medications like daily low-dose tadalafil might help maintain healthy tissue oxygenation between erections, preserving vascular capacity and nerve function. These measures support not just sexual performance but overall tissue health, sensitivity, and regenerative capacity through improved microcirculation that benefits cellular function at the most fundamental level. Sexually transmitted infections continue rising globally despite increased awareness, with many causing few or no noticeable symptoms until serious complications develop. Beyond sexual exposure, bacterial and fungal infections commonly occur from improper hygiene, compromised immunity, diabetes, or antibiotics that disrupt normal protective bacterial balance. These infections don't just cause immediate discomfort and inflammation, they can lead to chronic tissue changes, scarring, urethral strictures, and systemic health problems when inadequately treated or allowed to recur repeatedly. Perhaps most concerning is how common infections like HPV can lead to penile, anal, and oropharyngeal cancers. Yet vaccination and prevention measures remain dramatically underutilized by men compared to women despite equal risk for certain cancers. This infection vulnerability represents one of the most preventable yet frequently overlooked aspects of male genital health, with consequences ranging from minor discomfort to life-threatening conditions that could be avoided through straightforward protective measures most men neglect until problems develop. Implementing proper infection prevention requires multiple protective measures that address different transmission routes and risk factors. First and most importantly, practice consistent safe sex with proper condom use for all new or non-monogamous partners, with comprehensive STI testing for both partners before discontinuing protection in established relationships. Consider HPV vaccination if you're under 45 and haven't received it previously. It protects against the most common cancer-causing strains and genital warts that affect millions of men annually. Maintain appropriate blood sugar control if diabetic, as elevated glucose significantly increases infection susceptibility through multiple mechanisms including impaired immune function and increased tissue glucose that feeds pathogens. Avoid sharing towels, underwear or swimwear which can transfer fungal organisms even between family members. Clean sex toys thoroughly after each use with appropriate sanitizing products specifically designed for this purpose rather than general household cleaners that may leave irritating residues. For men with recurrent infections despite these measures, discuss with your doctor whether you might benefit from prophylactic approaches such as periodic antifungal treatments, probiotics to restore healthy bacterial balance, or immune-supporting supplements that improve your natural defenses against common pathogens. This multi-layered approach significantly reduces infection risk through complementary mechanisms that protect both your health and your partner's well-being through responsible prevention rather than reactive treatment after exposure has already occurred. Taking proper care of your penis isn't just about maintaining sexual function or avoiding discomfort. It's about protecting your overall health, quality of life, and potentially identifying early warning signs of serious conditions before they threaten your well-being or even your survival. These 5 essential care protocols represent the medical consensus on best practices developed through decades of urological research and clinical experience treating thousands of preventable conditions that dramatically impacted patients' lives. By implementing these evidence-based approaches as part of your regular health maintenance routine, you're not just safeguarding your intimate health and function. You're potentially catching early warning signs of serious conditions that affect your entire body before they progress to dangerous stages. Remember that genital health reflects overall health in remarkably accurate ways. Circulation problems below often signal cardiovascular issues developing throughout your body. Infections may indicate immune dysfunction or metabolic disorders that affect multiple systems, and changes in function can reveal neurological or hormonal imbalances that impact everything from mood to cognitive function. The few minutes required for proper care represents one of the highest value health investments you can make. One that could quite literally save your life through early detection of highly treatable conditions before they progress to require more invasive interventions. Your commitment to these 5 protocols isn't just about genital health, it's about taking control of your overall well-being through informed, proactive care of an area too often neglected in men's health discussions. Tell me in the comments which of these 5 essential care protocols surprised you the most or which you plan to implement immediately in your own healthcare routine. Subscribe and enable notifications for more evidence-based medical information that cuts through myths and misconceptions about men's health topics rarely discussed with such medical clarity. Type 1 if you're already practicing most of these protocols in your daily life, or 0 if this information was mostly new to you and changed your understanding of proper care. Share this video with the important men in your life who deserve to know these medical facts that too few doctors discuss openly with their male patients during routine visits. Remember, your most sensitive organ deserves your most intelligent care. Start implementing these protocols today for benefits that extend far beyond sexual health to protect your overall well-being for years to come.